Moving toward the future. Healy Health Systems. Implementation of electronic health records. A strategically aligned initiative. The following presentation is made possible in part by the collaborative efforts of Kia Amber Tate and Kadeen Mitchell. The implementation of electronic health records supports our 2009 leading strategic initiative of becoming a defining national health systems leader. Our mission statement behind our electronic health record implementation project is to develop leadership as a quality health systems provider by improving operational efficiency and effectiveness through the enhancement of quality of care. The implementation of electronic health records will enhance quality of care by improving the continuity and standardization of care. Expected outcomes include the reduction of medical errors, increased physician efficiency, and the streamlining of patient care. The implementation of electronic health records supports our overall mission of patient first. The implementation of electronic health records will be done through the use of project management. Project management has 5 primary stages, as seen here: initiate, plan, execute, control, and close. We're going to closely examine the second step, planning, as it relates to the implementation of electronic health records in Healy Health Systems. Planning is the most important process group in project management. Planning identifies the structure and proper needs for organizing and managing a project. Without proper planning, our lovely illustration is most likely to occur. Here we have a snapshot of our project plan for the implementation of electronic health records. We have projected a total duration of 325 days, which allows us to estimate the entire project timeline from start to finish. The implementation of electronic health records is divided into several segments, also known as tasks. As you can see, each major task and the time needed to complete the task is defined. The implementation of specific tasks are dependent upon the others, which is formatted through the use of predecessors. The following features the Gantt chart of our project timeline. The Gantt chart was developed by Henry Gantt in 1915. It serves as a graphical representation of the project timeline. The Gantt chart illustrates start and finish dates and summary elements of the project. This is an illustration of the first group of tasks which occur in our implementation process. The patient information management, pharmacy, and imaging tasks all begin on the same date, but have varying duration times. Each task features a set of subtasks, which is followed by the configuration and training time. Configuration must occur and be completed before training may begin. To the right of the task list, the Gantt chart illustrates the dependencies, the precedence network relationship between activities. The second phase is featured here, which highlights the second start date of August 19, 2008. Laboratory, radiology, nutrition and food services tasks begin on this day. The final and most consuming task, Clinical Information Systems begins on our last and third start date of February 10, 2009. It is estimated to take a total of 154 days to complete and features 10 subtasks. The subtask features links in the Gantt chart, as many are dependent upon another. For example, the vitals measurement subtask cannot be implemented until intake and output subtask is complete. This is evident by the presence of the predecessor line 64 as the vitals measurement task line and the links between the bars on the Gantt chart. One of the major advantages to using project management to implement electronic health records is the focus it places on time, resulting in effective time management. With estimations in place, we can have a clear sense of control over our deadlines. This sense of time often leads to tasks being completed ahead of schedule as we are striving to be efficient and meet the schedule. This can be easily demonstrated and adjusted in project media. We see here, if we were to achieve a shorter configuration time for order management, our completion date and duration time adjust accordingly. The project timeline may be adjusted continuously throughout the implementation process. The benefits of project management is clearly defined within our presentation of Healy Health Systems Electronic Health Record Implementation. Project management defines each major task and estimates the time needed to complete the task. It provides a framework for management review and control. Overall, it has the ability to add quality and value to an organization's project. The utilization of project management promotes growth, financial strength, and enhances the operating margin to allow for competitive growth. The provision of high-quality programs and services at a great value to our patients. This concludes our presentation, Healy Health Systems.